For the majority of my life, or at least the parts of my life that I can remember, my parents, and my dad especially, have been in a major battle with the healthcare system. They've both been doctors for 30 plus years, and I can recall specific patients who have come up to me and said how great my parents were at being doctors and treating them and just being great people, top of the line care. And I know that up until I was 12, my parents would always come home with smiles and stories about how they saved someone's life or how they treated someone who seemed untreatable. But right around that time, they would start to come home with frowns. And, they would yell and they would be angry and it wasn't really at each other, but it was more with each other. And they were just collectively upset. The more I listened to their arguments, the more I figured out that it was something with their jobs, that someone or something was keeping them from being doctors in the way that they knew how. And as time passed, they would always tell me and my sister that they didn't want us to come down the same path that they went down. I realized that they were having a lot of problems with the healthcare system. And the biggest issues that they would all tell us about were all connected. The number of workers was going down as the amount of people who needed care was rising. And the fatigue that those doctors were feeling was just monumental. And insurance companies took advantage of that fatigue to say that doctors were incompetent and not able to treat patients. The biggest problems with the healthcare system is the fact that workers are coming into the field less and less, while more and more people are living longer and needing more care. And the insurance companies are taking the power away from doctors to be able to do their jobs. And here is a more in-depth look at each of those problems. The decreasing amount of workers within the healthcare field is due to the extreme costs of obtaining a degree for the field. According to the academic counseling website, adding on to more than $100,000 in regular college tuition, the average in-state medical degree costs an extra $147,000, while an out-of-state degree costs an extra $243,000. Now, 73% of students who graduate from medical school have to take out a loan and then are in debt for a median number of $200,000. At a public medical school, the average four-year cost is $250,000 altogether, and at a private institution, $330,000. Secondly, people on Earth are living longer. Our doctors have gotten a lot better, and our medicines and our care has gotten monumentally better, and that means people are living longer. But people who live longer also have a longer time frame that they need care. In the last 50 years, the average life expectancy for an American has gone from 71 years of age to just under 79. This has also doubled in the last 140 years from 39 years old. Most older Americans have a chronic illness. And a chronic illness is an ongoing, generally incurable illness or condition that requires round-the-clock medical care, weekly, monthly, sometimes daily visits to a doctor, and they will affect a person's life immensely. 80 to 92% of older adults have at least one of these chronic conditions, and 50 to 77% have at least two or more. And the third biggest problem with the healthcare industry is that major insurance companies are taking power away from doctors and putting it in their own hands, in the hands of somebody behind a computer screen. Lots of people will not get healthcare because they know how expensive it can be. And these insurance companies use their power to micromanage doctors. And so now 1 of every 5 people who are uninsured skip out on receiving any treatment for their illnesses because of looming costs that they could not afford. Health insurance policies have different limits on the amount of coverage they give to policyholders. So people who have a policy in the health care insurance company, like a lower level coverage plan will cover maybe a third or a quarter of a good plan, but a good plan will cost immensely higher rates than a lower plan. Cheaper plans within the Affordable Care Act show less coverage for things like emergency room visits and dentist visits, but plans that cover necessary and needed ailments are astronomically higher than their cheaper counterparts. And I did an interview with my father, and I took a quote from that interview, and he said, "Insurance companies have people behind computers who decide a patient's course of care rather than letting a doctor do their job. Doctors are trained for many, many years to be able to diagnose and treat patients on an individual basis. And insurance companies are now taking away that power to save or make money at the expense of an ill patient." In 2015, my parents started a movement among doctors nationally in an effort to stop a force that was changing the profession. The movement was called Doctors for Patient Care, and they ran under the slogan, "Let my doctor practice, damn it." It garnered a significant following in helping block serious rules from being passed that gave insurance companies less and less power and started giving power back to the doctors. I later learned that this whole movement was to help bring back power to the doctors that they had previously been sequestered by the insurance companies. The entire problem is under the umbrella that healthcare can be mainstreamed to fit everyone. However, the fact is that everyone is unique and each individual person has a different problem with them. And them being different plays a huge role in the issues within healthcare. Doctors need to be free to treat each individual patient on an individual basis without restraint from a third party saying yes or no to save or make money at the expense of ill and vulnerable people.